Welcome to the Learning Pines YouTube. We hope this video helps.
You start now, sit upright and lean slightly forward. This keeps stomach contents down and opens the airway. Once positioned, take tiny sips, 1/2 teaspoon every few minutes, to prevent dehydration without triggering gag reflex. Make sure to cool your forehead or neck with a compress, because lowering body temperature and reducing sensory triggers calms the vomiting center. If you have an approved antiemetic prescribed, take it as directed. This acts on the brain pathways to blunt nausea. Now continue with focused actions to stop the reflex. You control breathing. Slow, diaphragmatic breaths at 6 to 8 per minute reduce autonomic arousal and calm nausea. Next, press the P6 point on your inner wrist for 30 to 60 seconds. This mechanical stimulation can interrupt vomiting signals. If tolerated, take ginger, about 0.5 to 1 gram, or ginger tea, because it soothes the stomach and speeds gastric emptying. Make sure to avoid fatty, acidic, or spicy foods that prolong irritation. To finish, progress gently. Once nausea subsides, move from clear fluids to bland carbohydrates, then to a normal diet over the next 24 to 48 hours. This prevents relapse. Make sure to track urine color. Pale yellow indicates adequate hydration, and replace electrolytes with oral rehydration if needed. If vomiting returns or you see severe pain, high fever, or can't keep fluids down for 6 hours, treat that as a red flag. Contact medical care promptly and consider antiemetic or Roman IV fluids per provider instructions.
Thanks for watching. Consider subscribing if we helped you.